There's a secret to fixing knee pain that not many people know about. Hi, I'm Dr. Dave Candy, and in this video, I'll explain what that secret is, plus share some tips to help you get both fast and lasting relief from knee pain. Now, there's a common misconception that the knee joint is just a hinge joint, kind of like a door swinging back and forth on its hinges. And most knee pain exercises just focus on two movements, stretching and strengthening into extension or straightening of the knee, as well as flexion or bending the knee. But the knee joint has the ability to move in small amounts in the side-to-side and rotational planes as well. And the secret to fixing knee pain is in knowing that most knee pain doesn't come from dysfunctions in bending and straightening, but rather from dysfunctions in those smaller, lesser well-known movements. Now, your tibia can shift one way or the other on your femur or thigh bone, or it can twist one way or the other on your thigh bone. And if it goes too far one way or the other, that can cause some knee pain. So first we'll go over some techniques to relieve knee pain almost immediately if you are having it. And then we'll go through what to do to keep that pain from coming back in the future. Now, the most common dysfunction people have in their knee joint is a lack of internal rotation. And that comes from a valgus movement like this, where your knee goes too far inwards. That drives the thigh inwards and the tibia relatively outwards on the femur. Now, you can check to see how much internal and external rotation of your tibia you have by sitting with your knees bent to about 90 degrees and then twisting inwards. Now, it's not your feet that you're actually looking at, but the tibial tuberosity, this bump right here. And you want to see if there's a difference in how much one can twist into internal rotation or external rotation. Now, if you notice that you have less internal rotation on your painful leg, then you'll do the following technique. You'll cross one leg across like this. Now you're going to take your hand and put it on the underside of your tibia, or the outside of the tibia. You'll take the other hand and put it just at the very end of your femur or thigh bone, right before the knee bends. Now you're going to pull with this hand and push with this hand. And it's a slight arcing or twisting motion like this. So you're creating both a lateral glide of the femur on the tibia, so it's this type of movement, as well as a rotation, a twisting of the tibia into internal rotation. And then once you get to sort of an end range, this isn't going to be a very large movement, probably about 1/8 of an inch. So go to you feel an end range and then just hold that position, or you can do very slight oscillations. But if you're not familiar with this, I would just recommend holding it for about 10 seconds and then relax. And then push again, hold for another 10 seconds and relax. And repeat that movement for about a minute. Then recheck and see if you've improved the internal rotation of your tibia. That does often relieve pain rather quickly, and sometimes you get immediate relief from the pain. But something caused that joint dysfunction to happen in the first place. And if you don't fix that problem, it will eventually come back. Now, as I mentioned before, the most common reason for a tibial internal rotation dysfunction is excessive pronation or flattening of your foot, as well as excessive internal rotation of your femur. Now, this concept is a little bit difficult to grasp because everything is going inwards. And so you would think that this would be internal rotation of the tibia. But the femur is rotating inwards and the tibia is rotating inwards, but the femur is internally rotating more than the tibia. So even though both are going inwards, it's a relative external rotation of the tibia on the femur. So in order to prevent excessive external rotation of the tibia or a tibial internal rotation lack of movement, you want to avoid that excessive pronation valgus movement of the knee. Now, that typically happens because of problems at the foot and ankle, as well as weakness in the hip. If your hip abductors, meaning moving out to the side, and external rotators, meaning rotating out to the side, are weak, that can cause your knee to collapse inwards as you're squatting or going up and down stairs. And so you want to learn to prevent that. Now, one way you can do that is by doing a squat with external rotation of your hips. So what you'll do, you'll spread your feet and then put your feet in a position where they feel comfortable. Doesn't matter if your feet point straight ahead or point outward slightly, just put them in a position where you feel comfortable. Now you'll go into a little bit of tibial internal rotation just by kind of scooping your feet. So doming your arch like this. Now you're doming your arch and then pushing your knees outwards at the same time. So the tibia is kind of scooping inwards into internal rotation while your femurs are going outwards into external rotation. And then you'll squat down, keeping the knees driven out. Go as deep as you feel comfortable going, and then drive back up by pushing through your heels. To see that from a side view, you'll set your feet at a comfortable position, dome your arches, so lift the inner part of your arch right there, drive the knees outwards, and then sit your hips back, keeping the weight down through your heels, push up through the heels, and then squat back down. And just go as deep as you feel comfortable going for about 10 repetitions. That helps strengthen your glute muscles as well as prevent pronation of your foot by strengthening your arch muscles and your tibialis posterior, which turns the foot inwards like that. Now, a progression off of that is doing a lunge, which is basically the same movement pattern but on one leg. So you'll dome the arch here, turn the knee outwards, and then go down as deep as you feel comfortable going, and then come back up, go down, keeping the knee turned outwards, and come back up. To see that from the front, you'll plant your foot, turn the knee outwards here, go down, keeping the knee turned out, and then back up. You don't want to allow this movement to happen, which is a very common problem that happens when people do lunges or single-leg squats. So that's the techniques to strengthen your hip. Now, when you're walking, people also tend to flatten or overpronate their foot. So another great technique to strengthen your hip muscles while you're on one leg is just practicing standing and balancing on one leg. Now, you're not just standing there. You want to turn your knee outwards just slightly and kind of grip the ground with your foot muscles. So stand on one leg, keep your pelvis level with the floor, turn the knee out slightly, dome the arch there and grip the ground with your foot, and then practice balancing on one leg, keeping the knee turned out and the arch lifted, and then practice on the other side. Turn the knee out, arch the foot, and then stand and balance on one leg. Now, a progression of that is moving into a single leg squat. So very much like the lunge, you go into that single leg balance position and then just do little tiny squats, keeping the knee relatively turned out and not letting it knock in to that position. Now, if you're finding this video helpful so far, take a moment to hit the share button below this video and share it to your Facebook page. You never know who in your circle of friends may benefit from seeing these tips. Now, there's one final thing that can cause excessive pronation of your foot and internal rotation of your femur, and that's stiffness in your ankle joint or in your calf muscles. When you go to take a step, you have to move your body forwards over your foot. And if your calves are too stiff, the only way that your body can get around that is by pronating your foot and going around the ankle joint. Now, if you'd like to learn tips to relieve stiffness in your calves, check out this video over here. But before you go, if you found this video helpful, make sure to give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching, and I'll see you in the next video.